So what is meant by the PERT technique? Very good. Muhammad Tariq, I'm very happy to see you after a long time. So PERT technique. I advise all of you to download the UMedico app. There's many more things we are introducing. We are introducing quizzes, betting the quizzes. You can challenge somebody online to join you in a quiz to fight with you, and there will be points, levels of your knowledge in each of the high yield topics, comparative analysis, everything will be available on the UMedico app, which is going to be released next week. So that is the reason I advise you to be on the UMedico app and ask your friends to be on UMedico app, which is going to translate into a betting app on the quizzes on the high yield topics, so that anytime 24/7, if you're feeling bored, you can just open up and randomly identify someone across India, across the world, to fight and challenge and play a game. So that is how the UMedico app is evolving. Now, PERT analysis, program evaluation and review technique. So fundamentally, what is done in this? Whenever you are having a big plan, like you are conducting a college function, you divide that into small goals. First, whom to send invitation, where to get the performers on the stage, then how to get the sponsors. So multiple small activities are created as small goals, and you deliver. So there are two methods: critical path method and PERT. PERT is a probabilistic method, but CPM is called a deterministic model. In a probabilistic model, non-repetitive jobs like planning, scheduling, they are the ones for which you will be using PERT. Whereas repetitive jobs, suppose if you are building a house, any number of houses that you build, it will be the same principle by which you will be building it. So there is a reason there you will use CPM. Then it is based on the events that you calculate the outcome in case of the PERT. Whereas it is based on the activities that you will be judging. The CPM is what you have to basically remember. And PERT is related with activities of uncertain time, whereas CPM is related to those activities which have got a finite time in which they are going to be fulfilled. That's a main difference. Human milk versus cow milk. Last 18 years, this is the same favorite question of the examiner, which you have to be doubly sure. So typically, the iron content, carbohydrate content of the human milk is higher than that of the cow milk. Mother's milk is sweeter because carbohydrate content is higher. Now, what is the definition of serial interval and what is the definition of the incubation period? So, the gap in the time between invasion of infection and appearance of clinical feature is called as the incubation period, not serial interval. Whereas between the onset of the primary case and the secondary case. First, Ramu got cold. Then Ramu's sister Parvati got cold. Then Parvati becomes the secondary case. So between Ramu getting fever and his younger sister later on getting the fever, the time interval is basically called serial interval, which is a measure of the communicability of the disease, is what you need to basically understand. So what are the various tests which are available to check the degree of pasteurization of the milk? Phosphatase test, standard plate test, methylene blue test, not the nitric acid test, they are all considered to be the tests for pasteurization. Can online students can punch in the chat window whether the voice is loud and clear and the transmission is clear? Can you please punch? Yeah. Now, with regard to the Vision 2020, there are certain clinical conditions planned to be controlled by the Vision 2020. So cataract surgery is performed not at the primary level, it is performed at the district level is what you have to basically remember. So cataract, childhood blindness, refractive error, corneal blindness, glaucoma, diabetic retinopathy, trachoma, these are all the conditions which are covered under the Vision 2020 is what you have to basically remember. MedQuest is asking a question, sir, from where to get your notes? Please call our helpline. I am typing here 9000868 is our helpline. She will be able to send you the PDF of the notes of this present discussion. And also, please like our Facebook page, UMedico's Facebook page, and we will be updating a lot of free content on the Facebook. Also, we will upload it into your account in the UMedico app. There are various ways by which you can get the notes. Now, what is this condition? This is nodular episcleritis. So nodular episcleritis, it can be seen in case of SLE. It takes longer time to resolve compared to the diffuse type of episcleritis. It is more symptomatic and it is painful. That's what you have to basically remember. Now you are seeing a patient who has muscle weakness, low intelligence quotient, hypersomnia, multiple endocrinopathies. So what is this condition? This is a case of myotonic dystrophy. So in myotonic dystrophy, it is the posterior type of a subcapsular cataract is the most common type is what you have to basically remember.